Which of the following is the most common method used to oxygenate the blood during cardiopulmonary bypass? A. Membrane oxygenator. B. Bubble oxygenator. C. Ultrafiltration. D. Hemodialysis. Answer: A. Membrane oxygenator. Explanation: the membrane oxygenator is the most commonly used device for oxygenating blood during cardiopulmonary bypass. It uses a semi-permeable membrane to facilitate the exchange of oxygen and carbon dioxide without directly mixing the blood with gas, which reduces the risk of air embolism and other complications. Which of the following monitoring tools is used to detect and prevent the risk of air embolism during cardiopulmonary bypass? A. Arterial blood pressure monitoring. B. Blood gas analysis. C. Ultrasonic air detector. D. Pulse oximetry. Answer: C. Ultrasonic air detector. Explanation: an ultrasonic air detector is used to detect the presence of air bubbles in the cardiopulmonary bypass circuit. Air embolism can be dangerous, and the device helps ensure that no air enters the arterial circulation, preventing potential complications such as stroke or organ damage. During cardiopulmonary bypass, how is the anticoagulant heparin commonly monitored? A. Through platelet count. B. By activated clotting time (ACT). C. By prothrombin time (PT). D. By hemoglobin levels. Answer: B. By activated clotting time (ACT). Explanation: the activated clotting time (ACT) is a common test used to monitor the effect of heparin during cardiopulmonary bypass. Heparin is administered to prevent clotting during the procedure, and the ACT helps ensure that the blood remains adequately anticoagulated. Which of the following is a key factor in monitoring blood pressure during cardiopulmonary bypass? A. Mean arterial pressure, MAP. B. Systolic blood pressure. C. Diastolic blood pressure. D. Central venous pressure, CVP. Answer: A. Mean arterial pressure, MAP. Explanation: mean arterial pressure, MAP, is the most reliable indicator of perfusion pressure during cardiopulmonary bypass. It reflects the average pressure in the arteries during one cardiac cycle and is essential in ensuring adequate perfusion of organs and tissues. What is the role of the cardioplegia delivery system during cardiopulmonary bypass? A. To oxygenate the blood. B. To cool the patient. C. To deliver a solution that stops the heart. D. To pump blood through the circuit. Answer: C. To deliver a solution that stops the heart. Explanation: the cardioplegia delivery system delivers a specialized solution to arrest the heart during surgery. This solution usually contains potassium, which causes reversible cardiac arrest, allowing the surgeon to perform procedures on the heart without it beating. Which monitoring technique is used to assess the oxygenation status of the blood during cardiopulmonary bypass? A. End-tidal carbon dioxide monitoring. B. Pulse oximetry. C. Oxygen saturation via a central venous catheter. D. Blood gas analysis. Answer: D. Blood gas analysis. Explanation: blood gas analysis is used during CPB to monitor the oxygenation status of the blood. This includes measuring the partial pressures of oxygen and carbon dioxide, PaO2 and PaCO2, as well as the pH, to ensure proper oxygenation and acid-base balance during the procedure. What is the purpose of retrograde blood flow in the cardiopulmonary bypass circuit? A. To remove air from the circuit. B. To prevent venous stasis and increase oxygen delivery. C. To cool the blood. D. To facilitate the removal of waste products. Answer: B. To prevent venous stasis and increase oxygen delivery. Explanation: retrograde blood flow is used to improve venous return and prevent stasis in the venous reservoir. This helps ensure adequate oxygen delivery and waste removal by maintaining proper circulation throughout the procedure. Which part of the cardiopulmonary bypass system is responsible for monitoring and adjusting the flow rate of the blood during surgery? A. Oxygenator. B. Roller pump. C. Arterial filter. D. Venous reservoir. Answer: B. Roller pump. Explanation: The roller pump is responsible for adjusting and maintaining the blood flow rate through the CPB circuit. It creates the force needed to move blood through the oxygenator, arterial filter, and back to the patient's circulation, ensuring that the perfusion is maintained at the required level. Which factor is most critical when selecting the size of the cardiopulmonary bypass circuit for a patient? A. The patient's age. B. The patient's weight and body surface area. C. The patient's blood type. D. The type of surgery being performed. Answer: B. The patient's weight and body surface area. Explanation: the size of the cardiopulmonary bypass circuit is selected based on the patient's weight and body surface area to ensure adequate perfusion. This allows for appropriate blood flow through the circuit and oxygenation to meet the metabolic needs of the body during surgery. What is the primary role of the venous line in the cardiopulmonary bypass circuit? A. To deliver oxygenated blood to the patient. B. To return deoxygenated blood from the body to the bypass system. C. To monitor blood pressure. D. To regulate blood temperature. Answer: B. To return deoxygenated blood from the body to the bypass system. Explanation: the venous line is responsible for returning deoxygenated blood from the patient's body to the cardiopulmonary bypass system, where it is oxygenated and then pumped back to the body through the arterial line.